a calcium that's really, really high quality, it's easier to get in the system. Bone healing and how we can accelerate that process, adding to what most people get inside of the medical system. So the first steps are to make sure that you have a soft calcium or an absorbable calcium. Too many times people are taking something really, really hard, some calcium carbonate, which is like eating granite, but even better would be to do some calcium malate or some calcium citrate. And then my very favorite, the most absorbable calcium that I found on the market is calcium lactate. Now, the reason why this is so important is because when you start talking about percentages of bioavailability, calcium carbonate is like literally 2% absorbable. Calcium citrate is 4 or 6% absorbable. And it's my understanding that calcium lactate is about 70% absorbable. So when you get a calcium that's really, really high quality, it's easier to get in the system.
Okay, we want to talk about calcium, and this little blurb that we put out on the internet is specifically talking about how to make bones heal and why calcium is so important. And again, going back into some old resources, I just have just an amazing respect for something that's so simple. And I see this all the time. Like, this is one of the most common things that I see on a blood test is calcium levels. So this is part of your complete metabolic panel. And this is one of the breakthroughs that we see for people is calcium. Do you have calcium in the right level? So let's kind of look at this, get a review here. All right. Let's see if I can get this over to the side a little bit. I want to talk about calcium. And here is some of the amazing things that calcium does. It's good for fever blisters, infections, cramps, hypothyroidism, osteoporosis, herpes, canker sores, coughing, insomnia during pregnancy, child supplement for osteoporosis, physiologic relaxation, important for soft tissue repair and hemorrhaging. And so here's what happens. The range for calcium is about 8.3 to 10.4. Ideal is 9.8. So many times people that don't feel very well, their calcium levels are really low. And you never want to see people about below 9.0, but there's a lot of people that are 9.1, 9.2. They don't feel very well. It's not flagged on the complete metabolic panel. So a lot of doctors don't pay attention to simple calcium. Now, you can't patent calcium. It's kind of like patenting vitamin D or oxygen or whatever. We know they have profound health effects, but it's just not taught inside of a traditional medical program. Okay, there is more calcium in your body than all other supplements. Okay, most of the time the calcium is too hard. So calcium carbonate, that's the most common thing on the market. That's usually what's in antacids and everything. And it is like eating granite and the body can't absorb it. So what does it do? It actually stores it up along the 26,000 miles of vascular system. And this is what makes your vessels hard. And so a lot of times people think that they're doing things that are really healthy and it's actually hurting or detrimental. So with that being said, you guys, we just want to make sure that there's aware calcium glycinate, calcium malate, calcium lactate are all bioavailable uh, sources. Okay, so calcium lactate has 5 grams of calcium and 1 gram of magnesium. There's your ratio of 5 to 2. Okay, sorry. This makes the pH of the product 5.2, which is on the acidic side. You have to have a reasonably acidic stomach to assimilate minerals. This is why so many people that have, osteoporosis, restless leg syndrome, bursitis, osteoarthritis struggle with those conditions because they can't absorb minerals because their stomach's off. I liked calcium lactate because we mix it with a parathyroid base in a different product called Calma Plus. It's really good with calcium and magnesium. It helps the ionizable form of calcium. It changes the pH. Now I got to get this closer so that I can read. If you get too much calcium, it precipitates out, like in the example, the bottom of a tea kettle. This is when you get calcium from limestone. That's the calcium carbonate. And calcium biocarbonate ionizes in the bloodstream. And what it does is it makes your joint stiff. So what that means is if you don't have healthy calcium levels, like you can make it so it just feels like you need to oil your joints. And so remember the steps of calcium. You got to get a soft calcium in the system, calcium malate, calcium glycinate. And then you have to have vitamin D picks it up out of the stomach and puts it into the bloodstream. And then bioflavonoids, also known as vitamin F, take it out of the bloodstream, put it into the bone. Vitamin K activates it in the bone. So many times, healthcare providers tell people, "Oh, you have osteoporosis, just take some calcium." What kind should I get? I don't know, whatever you get at the store, which is too hard. And then no one pays attention to all the other cofactors. This is why it's so important to have those cofactors to make things work.